by lighting the lamp. Thank you, sir. Now I would like to ask our principal sir to address the gathering.
In the last 100 years, I produced a lot of both researchers, doctors, which have served the society. So I hope you all will uplift the flag of Andhra Medical College wherever you are, and the same discipline is needed. Coming to today's program, as you are aware, this is a part of the Shraddha of the Foundation Day. This year we have the 100th Foundation Day. Next year we will have the centenary. So during this program, regularly since last few years, we have academic sessions which are being organized in all departments of Andhra Medical College. Today we assembled here for this suture and training. As you all know, surgery needs a lot of skills. I am a medical person. Mostly in medical, you need a lot of background, basics, clinical skills and all. But surgery needs a lot of art. You also have to be trained in this art. As you know, most of these need more of artistic skills and experience to do well in your surgical profession in the future. So I congratulate once again Dr. Manmadra and the Department of Surgery in actively participating in conducting this workshop on suturing and other aspects of artistic work in surgery. Thank you again, Mr. For academic and lecturer of surgery, the faculty of surgery department, students. So it's an honor and privilege for me to stand before you. As you all know, this year is the centenary of the Andhra Medical College, and I'm probably blessed to head the institute during this program, during this time. And also the alumni, both my 79 batch from MBBS and moving from here. And most of the time I worked with Andhra Medical College.
And my dear faculty and dear students who have come from faraway places across all the state of New Andhra Pradesh in order to participate in this basic workshop on surgical skills, which is being conducted as a part of 100th Foundation Day of the prestigious and most ancient medical college in the united state of Andhra Pradesh, that is Andhra Medical College. These are all the things which are being told by Dr. There is nothing more to tell you. But basically, I hope all of you, most of you at least, who have been attending this workshop are interested to become or choose surgery as their career. So, in order to enter into surgical career, the basic step is to learn suture techniques. Suture technique is the basic and the most important step which has to be learned by observation and then practice. So this will be the useful, this will be a simple as well as sometimes very complex suturing techniques will be there. So now basically, because we are all interested in surgical field, so our faculty and postgraduates, residents, senior residents will be showing you different surgical techniques. You can choose among them and you can practice, and you should become good surgeons in your future. And more so, some of you may want to become cosmetic or plastic surgeons. So you should keep more, interest in practicing this. And first of all, you have to learn. And I welcome you all to the city of destiny and have a pleasant day. Thank you all.
And also welcome to this workshop. To try to learn as much as possible. We are all here to help you. Any doubts, please clarify in between. Okay, we have our faculty here will help you. Thank you very much. All the best.
210 members, 6 batches, 50 added, 270 years.
ఇక్కడ డైరెక్ట్ లైవ్ వస్తుంది అక్కడ మనం డెమాన్స్ట్రేట్ చేస్తే అట్ ద సేమ్ టైం మనం చేస్తాం లైవ్ వర్క్షాప్ ఎప్పుడు వస్తుంది ఇప్పుడు థ్యాంక్ యూ
నేను అరుణ్ మాట్లాడు అది ఉంది డ్రెస్సింగ్ ఉంది అందులో కేబుల్ ఉంటుంది చిన్న
including Shraddha program from the Research Foundation and Environmental College. As well as the basic life support in the we were in many days really asked thanks to both and we were may have to learn the skills of you write to somebody. Last year I think in the World Cup, another football player and a cardiac arrest during the match. We could survive only because of the really rapid life support system. So there will be very happy number of events which may really come across during your career. So this workshop helps you in having a proper method of doing this basic life care or the initial management when somebody has a cardiac or any other untoward event. So that we can do, especially more important because sometimes you can get even in younger third grade, fourth grade, we have some cardiac problems to go. Whatever the reason, so this workshop may help you all to get these skills, and it's very important for everybody, whatever specialty you need to learn these skills. So this viewers, once again, thank you all for this talk. Thank you.
Welcome to this basic life support workshop. As sir said, this is a life-saving for the football player. President has collapsed on the stage. If any trained basic life support person that will CTF, he would have saved the time. So every situation should become a lifestyle. You people have to learn this and impart this skill to the other lay people also. So there are 3 types of calls for compulsory life support for lay people, and DCLS for paramedics, and comprehensive support team for the hospital. So we are giving the DCLS and DCLS. And sir, we are protecting house surgeons every year as a mandate. And we have the mannequins which are not the wrong where they are being used. So on the location, and some simulators are also being used. Today, I welcome you all and good day. Thank you.
What is surgery? How it is useful in our day-to-day life as a physician, as a practicing physician? How it is useful? How you can use these techniques in your day-to-day practice? Okay? So,
and various incisions and suturing technique. Because why a surgery surgery is the one important aspect of science where you go through your human body, you journey through human body, you cut through human body. So whereas other science, other departments of medicine and other, so they examine externally, but here as a surgeon you go through the human body and then enter the various tissues. So it's very important to, when you cut through its tissues and reconstruct that, suture it back to anatomically to regain the function. So for that we require a suturing technique. Various tissues require various sutures because all tissues are not same. Some tissues are tough, some tissues are soft. So various sutures be tissues which got separated. Okay. So we have PowerPoint presentation here. Dr. Jagdish is going to demonstrate all the PowerPoint presentation and the various techniques. And by live, here we are going to teach you. Okay? All the best.
Suturing skills workshop, and you know what the surgery is. It requires suturing skills, technical skills, but instead of not only acquiring surgical skills, we have to know the preoperative and postoperative workup also. So I congratulate all of you to show you are showing interest to acquire surgical skills. But I advise you and I suggest you to know all the preoperative and postoperative conditions of a patient or a person. It is acquired by the reading. We went into the operative room, but sometimes we have to act not according to the plan. We have to take decisions also. So you need to take decisions. You need courage to take decisions, knowledge to take decisions. So I encourage you to know every aspect of the surgical technique. You know, surgeon is a complete doctor. Physician can treat the disease, but surgeon can, as sir told, can enter into the body and repair and reconstruct. So surgeon is a complete doctor. I encourage all of you to take surgical branch in your future studies. Thank you.
Now
In surgical branches, so that's why you are here today. So we are here to help you with your suturing skills. It's good that you are interested in learning these suturing skills prior to your internship. So this will help you in your internship also. So all the best for your future endeavors. Thank you.
Let me talk in, permit me to talk in Telugu also. Okay, whenever it is required. Outside, what people think is with the doctor. Anybody can write medicines, right? Anybody can write medicines. But procedure and technical aspects, that's only we surgeons can do. I'm not saying that other doctors are inferior or we are superior, not like that, right? So what I'm saying is that every doctor should know the basic surgical skill and we should be able to provide basic surgical support and treatment to the patient whenever they come in emergency. Okay? Or say for example you are working in a PHC where a patient comes with bleeding, simple injury and bleeding. What if we are not able to control the bleeding? So he may die. It is fatal sometimes, he may die with bleeding. So it is a disaster, right? It is very bad on our part. So what I am saying is that every doctor, not only these 300 or 250 members, should be able to provide surgical skill or surgical treatment or emergency treatment. Every one of our doctors should be able to do and provide the basic surgical treatment whenever it is needed. That is the whole motto of our MBBS teaching, right? So let us start. What people surgical, for example, you are working in a PHC. Again, you are not able to provide the rural area, the deepest area, poorest people comes to you, and you are not able to suture the wound. For that matter, mana parents have injury, if you are not able to suture the wound and you are asking for some specialist help, that is very bad. That is very bad. So it is very necessary and very important to know the basic surgical skills, right? Okay. So, suturing is one of the important aspect of all other, apart from, madam already touched that pre-operative procedures, post-operative, etc., etc. That is very, very important. Regarding surgery, during surgery, it will take a lot of time to go back to the history, what was used as suture material, but nowadays, there are so many advances and there are so many developments in developing the suture materials. Okay, so that why suturing is important. Okay, under kandisunda. Okay, so to support and strengthen the wound until it completely heals. What if suture is not kept? It will not heal. Simple. Okay, if you don't put a suture, what happens? Okay, to reduce the dead space. What is dead space? Which is one of the cause for delayed wound healing. Okay, and if the approximation of skin height is minimize scarring. If improperly sutured, the scar, there will be hard scar. Okay, to minimize that scarring, there should be proper approximation of the edges of the wound. Okay, okay, all you can understand what I am talking. So, in this point of view, suturing technique is very, very important. Okay, we are all, nobody is masters by birth. We all learn, we all practice, day by day, you will learn step by step. Okay, so the most important fibers that are used to, again, for suturing. We will discuss what are the types of suturing materials available, we will discuss. Why suturing should be done? These are all the causes why suturing should be done. There are so many other causes, okay, but important causes, important reasons why you should use sutures, right? Chances are watching, n number of times the question is given. Suturing materials. What are the types of suturing materials? Absorbable and non-absorbable. So what is the meaning? Meaning itself shows absorbable. The suturing material will be absorbed into the body. Okay, some suturing material it will take 14 days. Some suturing material it will take 90 days. So it depends upon the time of duration. They are separately classified. Material will be selected. So it's a choice of the surgeon. It's a convenience of the surgeon as well as the condition of the patient and the surgery you are doing. You will select the suture material. Okay? Again, with experience and time, we all learn all these things. Because now simply to remember, what are the types? Absorbable and non-absorbable. Okay? Absorbable was natural is just basics we should know what procedure we are doing and what suture material we should use. Okay? Depending upon the procedure, we have to select the suture material. Okay? So regarding synthetic, then you can see vicryl, polyglycolic acid. Okay. This is silk. Andhra chudandi. So this is silk. Silk is commonly used for skin clothing. Okay? Now there are so many suturing materials and all. The advance of technology, right? Silk is a natural non-absorbable suturing material, and the synthetic question, which type of needle it is given in the unit. Open change. What are the suture materials? Okay. Absorbable, non-absorbable, absorbable, cataract, okay, vicryl, synthetic, cataract is natural, and non-absorbable, proline, and silk is natural, proline is artificial. That's all. So this is This is vicryl, absorbable. This is vicryl, right? How it looks? This is. Okay. So, this is silk. What is this? Is rolling, unabsorbed. ఒకసారి సూచన చేస్తే లైఫ్ లాంగ్ ఉండిపోతుంది బాడీ. ఓకే, once you complete it, we'll start. Free, not necessarily under final year awards, juniors also. Tomorrow will come to the exam, will become outside house. Then you will be learning. It is advantage for you. So that you are well versed with the social techniques, everything. Okay. So, better కదా. ఫర్దర్ ఇన్సిషన్, ఇక్కడ దీని మీద మనం ఇన్సిషన్ ఇస్తాం. ఓకే, థింక్ దట్ దిస్ ఈజ్ ఏ wound of the patient. What you do, what you give, what incision is given, that is the wound of the patient. అందరూ కూడా అది wound కింద ఇమాజిన్ చేసుకోండి. Full procedure, all the surgical principles should be followed. Okay, what are all the surgical principles? Very simple. For example, this is the wound of the patient. నేను ఇన్సిషన్ ఇవ్వట్లేదు. Think this is the wound of the patient. Okay, actually there is a instrument called sponge holder. There is an instrument called sponge holder. You hold this gauze piece, fold చేస్తాం, fold చేసి with the sponge holder. Actually దీంతో పట్టుకోకూడదు, పోద్ది, but I'll do it with your permission. Okay, and there is a technique of holding all the instruments. You have to remember, you cannot hold as you like. Okay, instrument always should be hold like this. You use your ring finger, you keep it here, you use your thumb. అందరూ తీసుకొని ఇన్స్ట్రుమెంట్, మీ దగ్గర ఉన్న ఇన్స్ట్రుమెంట్ అందరూ తీసుకొని you handle it. You please చేస్తారా, say yes, then only I will go forward, because it is very important. Okay, only one hand, Babu, only one hand. You hold it one hand only. Okay, like this. అందరు కనిపిస్తుంది అక్కడ. సర్జికల్ స్పిరిట్ రా wound మీద పెడితే పెయిన్ వస్తుంది, మంట వస్తుంది. జనరల్లీ వీ డోంట్ యూజ్ ఇట్. ఓకే, హైడ్రోజన్ పెరాక్సైడ్ వాడవచ్చు. ఓకే, బెటాడిన్ వాడవచ్చు. దెర్ ఆర్ సర్టన్ యాంటీసెప్టిక్స్ విచ్ యూ హ్యావ్ టు గో త్రూ. ఓకే, బిఫోర్ ఎగ్జామ్ డెఫినెట్లీ యూ గో త్రూ. సో ఇక్కడ మనకి అవైలబుల్గా ఉంది, స్పిరిట్ ఉంది కాబట్టి సర్జికల్ స్పిరిట్. ఐ విల్ యూజ్ ఇట్. ఓకే, ఐ విల్ డిప్ ద gauze piece into the surgical spirit from center to periphery. చూస్తున్నారా, ఇది wound అనుకుంటే woundకి దగ్గరలోంచి ఐఎమ్ సెంటర్ టు పెరిఫెరీ, ఐఎమ్ గోయింగ్ లైక్ దిస్. ఓకే, అండ్ ఐఎమ్ టర్నింగ్ దిస్ అండ్ యూజింగ్ దిస్ ఇన్ సేమ్ వే ఫ్రమ్ సెంటర్ టు ద పెరిఫెరీ. ఓకే, సో ఐ విల్ నాట్ కమ్ బ్యాక్. Everyone should wear the gloves. సారీ, ఇది ఇంకా డ్రేపింగ్ ముందే చేయాలి, సారీ. నౌ ఐ గ్లౌజ్ వేసుకున్నాను. ఓకే, అండ్ డ్రేపింగ్ కూడా అయిపోయింది, wound కూడా క్లీన్ చేస్తాం. ఓకే, నౌ జాగ్రత్త అందరూ. దిస్ ఈజ్ సర్జికల్ బ్లేడ్. ఈ సైజ్ ఆ సైజ్ కాదు. సో యాజ్ యూ wound కొంచెం సెపరేట్ చేయండి. కొంచెం సెపరేట్ చేసుకుంటారు, సో దట్ యూ కెన్ స్విచ్ ఇట్. ఓకేనా, అలా సెపరేట్ చేసుకుంటాం.
I wish you all a wonderful experience. I have seen that the boards are made and the surgery is being done. So all the best to you. Go ahead.
Thank you. You load it అందరూ లోడ్ చేయండి. ఇదంతా కావాలా? డెఫినెట్లీ కావాలి. And if there is any bleeding, you stop the bleeding. Now everything is ready for suturing, right? Okay. This instrument is called as needle holder. Needle holder. Technique is same. Holding technique is same. Ring finger, thumb, and your index finger is over the needle holder, like this. Technique is same. Now you take the silk. You take the silk and you insert. There is a eye hole in the. So each pad is for yourself only. After completion, you can take it home. మేము ఇది మీరు కంప్లీట్ చేసి ఇది ఇంటికి తీసుకెళ్ళిపోవచ్చు. మీరు అందరు కూడా తీసేస్తాం. సో ఫ్రీగా చేయండి, నో ప్రాబ్లం. ఇంట్లో ప్రాక్టీస్ చేసుకోవాలి. ఓన్లీ ప్యాడ్ నేను ప్యాడ్ అని చెప్తాను. ఓన్లీ ప్యాడ్ ఇదే టైం
స్ట్రక్చర్ అలా చెప్పేసి స్ట్రక్చర్ అలా జూమ్ చేసి ఈ పాయింట్
అట్రోమాటిక్ ఆర్ రౌండ్ బాడీ నీడిల్. క్యాంపర్ పాయింట్ చూపించండి, తీసుకొచ్చి క్యాంపర్.
ఇంకోటి అంటే చాలు, ఇంకోటి ఇది కటింగ్ సార్.
రౌండ్ బాడీ లాగా ఉంది సార్. రెండు రౌండ్ బాడీ.
Okay. So both of them are round body.
జూమ్ చేయకు.
Just to know the difference, what is cutting needle, what is round body.
So you can see that this is you can see here the sir was telling about the eye of needle. See, we have introduced this suture to eye of needle. This is more traumatic. Here it is without eyeless needle. So the thread came through the back of the needle. So this is atraumatic. So most of us you are using now atraumatic needle instead of eye of needle.
See the cutting needle. ఆ మధ్యలో షేప్ వస్తుంది చూడండి, ట్రయాంగిల్ షేప్. దట్ ఈస్ కటింగ్. ఓకే, దిస్ ఈస్ ట్రామాటిక్. అంటే డిఫరెన్స్ ఏంటంటే ట్రామాటిక్ లెస్ టిష్యూ ట్రామా ఈజ్ అట్రామాటిక్. ఇట్ విల్ పియర్స్ దో దెర్ ఈజ్ లెస్ ట్రామా ఆఫ్ ద టిష్యూ. whereas this cutting needle, it traumatize the tissue. So it depends upon the place where you use it. Okay, anastomosis, bowel anastomosis చేసేటప్పుడు generally we use atraumatic needle so that there will be less trauma to the bowel wall. Okay, ఇప్పుడు స్కిన్ సూచర్ చేస్తాం, స్కిన్ నైలాన్ ఉంటుంది, అక్కడ కటింగ్ నీడిల్ సో దట్ స్కిన్ థిక్గా ఉంటుంది కదా, దెర్ విల్ బి మోర్ థిక్నెస్ ఆఫ్ ద స్కిన్, దేర్ ఏ కటింగ్ నీడిల్ ఈజ్ యూజ్డ్. The incision, there is incision, okay, and again same pen holding technique. You hold with other hand the forceps, dissecting forceps. I will cut a piece. Here another piece cut chesindi so that now the wounded simple suture you can insert like this. Come out. Okay. So underneath, I'm going underneath. Okay. So equal distance lo తీసుకోవాలి, లోపల తీసుకొని బయట. You cannot insert it like this. So ఈజీగా వస్తుంది లోపల. ఓకే, మీరు అందరూ అదే చేయండి. రిస్ట్ షుడ్ బి లైక్ దిస్. అందరూ పెట్టారా? సో నెక్స్ట్ సార్ చెప్పినట్టు సింపుల్ సూచర్. విల్ స్టార్ట్ సూచరింగ్. అగైన్ చూడండి, అగైన్ చూడండి.
పెట్టిన ఇంకేం చేస్తారు? వద్దన్నారు కదా మీరే. ఇప్పుడు మార్చుకుంటారు. Any doubts in the simple knot? Please raise your hand. Anybody, any doubt? నేను వచ్చి నేర్పిస్తాను. Our faculty is here. Okay, shall I go to next step? Okay. So next one is matter suture. Tissue, sometimes it is difficult to bring together the tissue. The tissue may be edematous, or there may be dead space between them. At times you have to pull the two edges together. In that condition you have to keep the mattress suture, and with mattress suture the approximation will be better. Okay, that's why very commonly used suture is mattress suture. Okay, simple suture generally surgeons will keep it because with experience they will do it very speedily. For beginners, mattress is useful generally. So there is no doubt of approximation. Approximation is good, and there is less dead space also. Okay. So today now let us go with one more suture. So again, you take a bite, go deep, you come out. Okay. one more bite. Come on. ఇప్పుడు ఇంతవరకు సేమే, ఇందాక సింపుల్ సూచన లాగే చేసాం ఇక్కడ కూడా. ఓకేనా? నౌ యూ ఫాలో ఇట్. You take the edge. You take the edge. Edge ni ఇలా హోల్డ్ చేయండి.
కొంచెం ఇలా తిప్పండి, మీరు ఇలా తిప్పండి.
ఎడ్జ్ తీసుకునేటప్పుడు యూ కెన్ హోల్డ్ లైక్ దిస్, బట్ ఇట్ ఈస్ డిఫికల్ట్. సో చేతులు తీసేసి హోల్డ్ లైక్ దిస్. అర్థమవుతుందా? యూ హోల్డ్ లైక్ దిస్, విత్ అదర్ హ్యాండ్ యూ హోల్డ్ ద ఎడ్జ్. కమ్ అవుట్. Again you hold the edge. కట్రో ఉంది, ఎక్కువ తీసుకుంటున్నా, యాక్చువల్లీ తక్కువ తీసుకున్నాను. కట్రో అవుతుంది, యాక్చువల్లీ దగ్గరలో తీసుకోవాలి. ఓకే? అండ్ సేమ్ టెక్నిక్ ఇందాక చెప్పుకున్నట్టే, లాంగ్ హ్యాండిల్, షార్ట్ హ్యాండిల్. ఇక్కడ ఎడ్జ్లో నైట్ బయట తీసుకున్నాం, ఇక్కడ ఎడ్జ్లో బయట తీసుకున్నాం. సేమ్ టెక్నిక్. చూసారా? అప్రాక్సిమేషన్ బాగా వస్తుంది. Scissors. అలవాటు అయిపోయింది. Scissors. So this is the mattress edge, horizontal mattress. అనిపించిందా అందరికి? అనిపించిందా? అబ్బో ఎస్ నో. ఫస్ట్ బైట్, సెకండ్ బైట్, లైక్ ఎనీ అదర్ సింపుల్ నాట్. ఇక్కడ ఎడ్జ్ తీసుకుంటాం, ఎడ్జ్ ఆఫ్ ద స్కిన్, ఇక్కడ ఎడ్జ్ ఆఫ్ ద స్కిన్, ఇక్కడ నాట్ వేస్తాం. ఓకే? 50,000 రూపాయలు ఓన్లీ ట్యాక్స్ అవుతుంది. ఆఫీస్ ఆఫీస్ ఇవన్నీ రాజేశారు. ఓకేనా? Suturing. Okay? Students, extraordinary work they have done. I know how difficult it is to prepare. ఈ వేలు మీదకి ఇప్పుడు ఈ వేలు మీదకి తీసుకురండి, ఇలాగ ఫోల్డ్ చేసి తీసుకురండి థ్రెడ్ దీని మీదకి, లైక్ దిస్. అందరూ చేయండి ఇలాగా. ఇలా పట్టుకోండి ఫస్ట్. చూసారా అందరూ? ఇలా పట్టుకోండి ఫస్ట్. తర్వాత ఇలా చేయండి, దీని మీదకి క్రాస్ చేయండి. అండ్ ఈ మిడిల్ ఫింగర్ను వాడి మిడిల్ ఫింగర్తో లాగాలి థ్రెడ్ని. ఐఎమ్ డూయింగ్ ద సేమ్ థింగ్. ఓకే? అర్థమైంది? అర్థం కాలేదు? వెరీ సింపుల్. కాంప్లికేటెడ్గా అనిపిస్తుంది, వెరీ సింపుల్. వెల్కమ్. ఫస్ట్ మామూలుగా తెలీదు. యు హోల్డ్ లైక్ దిస్. పర్లేదు 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 పర్లేదు, డిఫికల్టే, బట్ చూపించాలి కదా. దెర్ ఈజ్ ఎ మెథడ్. ఈ ఫింగర్ వాడతారు ఇలాగా, ఈ ఫింగర్ తీసుకెళ్తాం కింద నుంచి. టూ హ్యాండ్స్ వేసేటప్పుడు కరెక్ట్గా లాక్ అవుతుంది అనమాట. ఆ లాకింగ్ ప్రాపర్గా వచ్చిందా లేదో కూడా చూసుకోవాలి. ఓకే? సో ఎనీ నాట్ తీసుకుందాం, ఏదో ఒక నాట్. ఈ హ్యాండ్తో ఇలాగ వేసాం కదా, ఈ హ్యాండ్తో ఇలాగ వేసాం కదా, ఈ రెండు వేసినప్పుడు మనకు లాక్ ఇలాగ రావాలి. చూసారా లాక్ ఎలాగొచ్చిందో? లాక్ చూసారా నాట్ ఎలాగొచ్చిందో? అలా రావాలి. ఇది టూ హ్యాండ్స్తో వేస్తే కరెక్ట్గా వస్తుంది. ఒక హ్యాండ్తో వేసామనుకో ఒక సైడే వస్తుంది, రెండో హ్యాండ్తో కూడా వేస్తే రెండో సైడ్ కూడా వస్తుంది. రండి 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 రావాలి. నెక్స్ట్ బ్యాచ్ టైం వేస్ట్.
మహేంద్ర రెడ్డి, జీ లోకిత, ఎంపీవి సాయి శ్రీజ, జీ చరితాలయ, బి జయశ్రీ, సిహెచ్ బి చరిష్మా, బి పావని, ఏ హర్షవర్ధన్, జీ చాతుర్య, ఎన్ ప్రశాంత్ కుమార్, ఎన్ ప్రశాంత్ కుమార్, మహాలక్ష్మి కనకవల్లి, జీ రోహిత్, హైని, హైని, కీర్తన, సంపత్, సంపత్, బి హర్షవర్ధన్, బి హర్షవర్ధన్,
వాడిన నీడిల్ మీరు వాడిన wound. Okay, there are edges of the wound. You have to oppose them, keep them together with the help of sutures. That is suture. That is not suture. Okay, what is suture material? Suture material is, okay, for that purpose you have to keep sutures. Next, to reduce the dead space. What is dead space? You give a incision or after there is a injury, laceration. If you don't close them without any space together with sutures, there will be space left behind. This is called dead space. What is the danger with dead space? There may be color, which suture material, what is the size, where you should use it, etc. Okay? So there is a absorbable natural suture material is cast electrode. Okay, absorbable synthetic suture material is vicryl. It is polyglycolic acid. Very commonly used. మీ అందరి దగ్గర ఉంటుంది silk. You see, this is the silk. This is the silk. Silk is used for suturing of the skin. Very commonly used, very cheap, available everywhere. So silk could be, you can use in the while suturing the skin. Okay, this is the silk which we use in day-to-day of our practical. So now you can keep it, it will be there that now. The vehicle that will be absorbed after 90 days. 90 days. Okay, so I cleaned the wound now and I will keep drapes. Drapes are not here. I will keep the drapes, okay, so that I can use your ring finger in one hole and thumb finger in another hole, and your index finger will support the instrument like this. మీరు ఇలాగే పట్టుకోవాలి ఇన్స్ట్రుమెంట్. దెన్ యూ విల్ హ్యావ్ బెటర్ మూమెంట్స్, ఓపెనింగ్ అండ్ క్లోజింగ్ అండ్ సపోర్ట్. యువర్ ఫింగర్ విల్ సపోర్ట్ ఫర్ ద మూమెంట్స్ ఆఫ్ ద ఇన్స్ట్రుమెంట్. ఓకే, దీస్ ఆర్ ద మూమెంట్స్ ఆఫ్ యువర్ హ్యాండ్. Surgery is all about hand movements, no? Technically, this is all our hand movements. All the convenient movements should be used while doing the surgery. మనం ఎలాగో పట్టుకుంటే చేయలేము కదా. There are certain movements which you have to adapt yourself. అది ఒక రోజు రాదు, డే బై డే you will learn it. Okay? So this is how you hold the instrument. Okay? Ring finger and thumb. And this will support the instrument. Any instrument you take, you have to hold like that only. Okay? Okay. So now I have cleaned the wound. Now I have to make an incision. Okay? Incision. Before making incision, we should always have some imaginary lines, imaginary planes. What are the planes called as? What are the planes of dissection in surgery used? Avascular planes of dissection. Avascular plane. Avascular planes of dissection. So you should always have any procedure. For example, you are opening there are certain incisions already. Scientifically, certain incisions are there which you have to follow. Simple midline incision. For example, if this is the incision, I made an incision. Okay? Andra chain incision open. So you should always do a surgical procedure in infection-free and pain-free conditions. You should always maintain that discipline. You cannot do a procedure or a surgery without giving anesthesia. Okay? For that you have to practice. Take this needle. కంగారు పడి చేతులు కన్నం పెట్టుకుంటారు. ప్లీజ్ డోంట్ పంక్చర్ యువర్ సెల్ఫ్. The 2 knots we generally use knot as fixed చేసేయండి. Okay. How to keep it? There are 2 procedures. Okay. ఇలా పట్టుకోండి అందరూ కూడా. You hold like this. ఇది మీద కనిపించాలి. ఇది మీదకి. You hold like this. ఫస్ట్ మూమెంట్ ఇది. నెక్స్ట్ ఇది. ఈ క్రాస్ రావాలి. ఈ మిడిల్ ఫింగర్తో దీన్ని తీసుకోవాలి. అందరూ ఇలా పట్టుకున్నారా? ఇంకోసారి చూపిస్తాను. ఇలా పట్టుకోండి. ఈ ఫింగర్స్ మీద నుంచి తీసుకురండి. తీసి ఇలా తిరగేయండి. ఇక్కడ వస్తుంది కదా ఈ 3 ఫింగర్స్ మీద. ఈ 3 ఫింగర్స్ టుగెదర్ ఉంచి దీన్ని ఇలా క్రాస్ చేయండి. ఈ చేతిలో ఉందని తీసుకొచ్చి ఇలా క్రాస్ చేయండి. ఈ మిడిల్ ఫింగర్తో ఈ థ్రెడ్ని పట్టుకోండి. ఓకే. ఇంకోసారి చూపిస్తున్నాను చూడండి. లైక్ దిస్. ఇంకోసారి చూపిస్తున్నాను. లోపల చూసారా? కరెక్ట్గా వచ్చిందా? అలా రావాలి, నాట్ కనిపించిందా? చూడండి, ఇటు చూడండి. సో బోత్ హ్యాండ్స్తో వేస్తే కరెక్ట్గా వస్తుంది అన్నమాట. ఇంకోసారి
learning things even before you come into the actual procedures. So anyhow, I am very happy that Dr. Jagadish is my student and now he is one of the instructor to the session now. I am very happy. And anyhow, so remember the surgery. To practice makes the man perfect. So the same principle holds good here. So how you practice the things, especially in the operative field, with interest and with, so that you learn better. So this is mainly practice. Okay. So thank you and
Yashash Chandra. Please. M. Tejaswini, D. Rishabh, P. Renuka Priyadarshini, P. Shrujana, P. Raja Satyasri, M. Navya, C.H. Santoshi Soumya, C.H. Joyce Pragya, C.H. Joyce Pragya, C.H. Vanilla Grace, B. Jahnavi, C.H. Deepthi Babal, Katari Maulya, K. Niharika, K. Blissy, R. Shivanandaraju, Priya Rathod, K. V. Abhishek, V. Joshna, A. Kartika, Reshma Vegi, A. Kartika, S. Puneet, R. Rajendra Kumar, S. Puneet, Farheen Fatima, G. Sharon, M. Hema Chaitanya, G. Akila, A. Shri Kumar, M. Yashwanti, Momita, Keshavi, Momita, Keshavi, Ankita, K. Swaroop, V. Sharon Gautami,
and there is I'm interested to give the feedback from Maharaja Minister. Viewers.
Somewhere white coats, and today I believe that's really true. This is Swaroop from Women's College, and today I'm very happy. Many of my friends would like to come, and they are coming tomorrow. Maybe they are many will be coming. ఈరోజు ఈ ఆర్గనైజేషన్ ఇలా చేసి ఫ్రమ్ ద స్టార్టింగ్ నేను కొంచెం లేట్ అయినప్పటికీ మీరు ఎలాగైనా రావాలి అని చెప్పి నాకు లాస్ట్ మూమెంట్లో రిజిస్ట్రేషన్ ఇచ్చి చాలా థ్యాంక్ యూ ఫర్ ఆల్ ది ఆర్గనైజ్ అండ్ సార్ ఇలాంటి ఆర్గనైజేషన్ కండక్ట్ చేసి ఇలా మాకు ఎంతో విద్య నేర్పిస్తున్నాను. వీఆర్ వెరీ థ్యాంక్ఫుల్. ఐ వుడ్ లైక్ టు టెల్ వన్ థింగ్, ఎండ్ అంటే అంతం, బట్ అకార్డింగ్ టు మీ ఎండ్ అంటే ఈ ఎఫర్ట్ అండ్ నెవర్ టీ డైస్. ఎఫర్ట్ నెవర్ డైస్. మన ఏదైనా ఈ రోజు ఇంత గ్రేట్ ఎఫర్ట్స్ పెడుతున్నారు కాబట్టి ఈ రోజు ఈ విద్య అనేది ఎప్పటికీ చనిపోదని నేను కోరుకున్నాను. థ్యాంక్ యూ వెరీ మచ్.
Session because we have to prepare for the next session. Thank you very much. Thanks. మీరందరూ యాడ్స్
Leave everything in your place.
future criteria. Okay? Every day in our whatever specialty, medical, surgical, every day minimum you have to provide minimum surgical treatment. Otherwise it is negligence. It is negligence. We are all half physician and half surgeon, MBBS now. Bachelor of Medicine, Bachelor of Surgery. As you all know that surgery is the mother of all surgeries. General surgery. Treatment. For example, you are working in a PHC, in a rural setup, where nobody is there. The only person is you are the medical officer. Okay. What problems are there? One is problem from the patient side. If you fail to treat him, for example, you fail to stop the bleeding, then it is a medical negligence, and problem comes from the local people also. Moreover, for example, any of our relatives, our own people may injure. You should be able to suture them, isn't it? You cannot call the help of keep together by putting the stitches. Okay? Yes or no? Yes. Enough. What's it? Okay. So, you keep stitches, a series of stitches to oppose the edges of the wound. Okay? That is the importance of stitch. Suture. What are the suture materials? Suture materials support and strengthen the wound until it completely heals. So they are separated. Once they are separated, there is no healing of the wound. Okay? Process that is the reason to support and strengthen the wound until it completely heals. 2. To reduce the dead space. What is dead space? For example, again, you have made an incision, 2 edges, and there is space between the edges. If you don't keep suture properly, there will be space left behind. That space is called dead space. What happens if there is dead space? Every possibility that there may be collection of serum, collection of all the factors which leads to the delay wound healing or wound dehiscence. Wound dehiscence. Okay. So what are all the reasons? These are all the reasons for delayed wound healing. Okay. Wound dehiscence. Surgical wound infection. If there is third one, to reduce the risk of bleeding and infection. If there is collection of serum and blood, hematoma, that is the source of infection. That is the source of infection. So, to reduce the chance of bleeding and infection, you have to keep sutures. To minimize the scar, if you properly approximate the wound and you properly suture it, the scarring is minimal. Okay, if you leave it like that without any suture, it will heal, but it will take time and there will be a big scar, ugly scar. So to prevent all these complications, you have to suture properly. Okay, these are all the few reasons why you have to. They will get absorbed. Absorbable. The name itself, absorbable. Non-absorbable. You use this suture material, it will be there till the end of the life, till he dies. That is non-absorbable. Okay? So, suture materials are classified into absorbable, non-absorbable. What is that absorbable? Absorbable again, they are further classified into natural and synthetic. Natural and synthetic. What is that natural absorbable suture? Catgut. Very commonly used. That is catgut. Okay? Catgut. And absorbable synthetic is polyglycolic acid or vicryl. So you have to see and feel all the suture material. What is sterilization, what is disinfection, etc. Sterilization is removal of all microbes, including spores. So, clean. So silk చూసారు, proline ఇక్కడ ఉంది. This is vicrylic absorbable material. Over 90 days, it will stay there more than 90 days and get absorbed.
Okay, this is absorbable suturing. So this is insert the silk into this eye opening. There is a hole. Insert chain on the silk. Take the silk and insert into the needle. Next slide. Next slide. Well, there are two types of needles used. One is round body needle or heteromatic needle. Needle is heteromatic or is less trauma. Not complete trauma. When you use it, there will be trauma, but less trauma to the surrounding tissue. Heteromatic. Another type of needle is cutting needle. Cutting needle like art structure, skin, fascia, వీటిలోకి ఇన్సర్ట్ చేసేటప్పుడు మనం ఈ కటింగ్ రౌండ్ బాడీ నీడిల్ లోపలికి దూరం అన్నమాట. ఇట్ ఈస్ డిఫికల్ట్ టు ఇన్సర్ట్. ఓకే, వైల్ suturing the skin, generally we use cutting needles. So how many types of needles? Round body needle and cutting needle. Okay, and arm needle అంటే డైరెక్ట్ గా నీడిల్ తో పాటు సూచరింగ్ మెటీరియల్ వచ్చేస్తుంది. ఇది కాకుండా సెపరేట్ నీడిల్ విత్ టు ప్రివెంట్ ద ఇన్ఫెక్షన్ సింప్లీ. సో బిగ్గెస్ట్ ఎనిమీ ఫర్ ఎ సర్జన్ ఈజ్ ఇన్ఫెక్షన్. On that matter, any doctor. You maintain all aseptic conditions to prevent the infection. Okay, you just inject the xylocaine at the cut edge of that wound, infiltrate it. Then you have to wash properly, thoroughly. You have to wash. Proper debridement should be done. Debridement and removal of dead necrotic tissue, all the clots. Any foreign bodies, dirty wounds, compound fractures. Okay, then you have to wash it thoroughly. You have to wash it thoroughly. Once all the foreign bodies and everything is removed, then only you have to suture. Here is the gloves. What is the use of gloves? Gloves, sterile gloves, by wearing the sterile important discovery. Holding every instrument. అందరూ గుర్తుంచుకోండి, ఫర్ ఎవర్ యు టేక్ నీడిల్ హోల్డర్. అందరూ పట్టుకోండి. దిస్ ఈజ్ నీడిల్ హోల్డర్. దిస్ యువర్ థంబ్ ఇన్ ద అదర్ హోల్. చూపించండి. రింగ్ ఫింగర్ అండ్ థంబ్, అండ్ దిస్ ఈజ్ హౌ యూ ఓపెన్. ఓపెన్ చేయండి అందరూ. Use like this only. This ring finger is here, thumb is here, index finger is here. Okay, opening it just is medaku toyali, thumb to medaku enakki medaku toyali, back and side. Appudu open avutundi. Open ayinda, open cheyadam vachinda andariki, cheyandi. Like this only you have to handle throughout your life. ఈ చేయడం రాకపోతే కష్టం. ఓకే, మీరు అందరూ కొంచెం వాటర్ ఏదో వేసుకోండి దాని మీద. సో యూ లుక్ ఎట్ దిస్. ఐఎమ్ క్లీనింగ్ దిస్ ఫ్రమ్ ద సెంటర్ టు పెరిఫరీ. ఓకే, అగైన్ సెంటర్ టు పెరిఫరీ, సెంటర్ టు పెరిఫరీ. ఐఎమ్ నాట్ కమింగ్ బ్యాక్. ఐ విల్ ట్విస్ట్ టు ద ఆపోజిట్ సైడ్. అగైన్ సెంటర్ టు ద పెరిఫరీ, సెంటర్ టు ద పెరిఫరీ, సెంటర్ టు ద పెరిఫరీ. సో లోపల నుంచి బయటకు వెళ్ళాలన్నమాట. రివర్స్ చేసామనుకోండి, ఇప్పుడు నేను బయట నుంచి లోపలికి వచ్చాను అనుకోండి, ఐఎమ్ క్యారింగ్ ద ఇన్ఫెక్షన్ ఫ్రమ్ పెరిఫరీ టు ద వూండ్. అర్థమైందా? సో ఎప్పుడు కూడా సెంటర్ నుంచి పెరిఫరీకి వెళ్ళాలి, బయటకు వెళ్ళాలి. లైక్వైజ్ సెంటర్ టు పెరిఫరీ. బయట నుంచి లోపలికి తీసుకురాకూడదు. ఓకే, వై ఇట్ ఈస్ ఇంపార్టెంట్? అగైన్ యూ హ్యావ్ టు ఫైట్ ద ఇన్ఫెక్షన్. బిఫోర్ డూయింగ్ ఎనీ ప్రొసీజర్ యూ హ్యావ్ స్టెరైల్ కండిషన్స్ ఉండాలి. Okay, aseptic condition, not sterile, aseptic conditions. Okay, cleaning అయిపోయింది. అండ్ డ్రేప్స్ అంటాం, టవల్స్, క్లాత్ ఉంటుంది కదా, క్లాత్ యూ విల్ కీప్ ఇట్ దేర్. సో So that it is restricted to that part only. Other part అనేది మనం డిస్టర్బ్ చేయకూడదు. Where you want to suture, there only you cleaning అయిపోయింది. Next, how to hold instrument, you all know. Ring finger, thumb and index finger to support the instrument. That is how you have to hold throughout your life, no other go. That is how you can easily handle the instrument. And there are movements, pronation, supination. చెయ్యి wrist movement ఉండాలి, ఇంత తిప్పకూడదు, అంతే లేదు, జస్ట్ మూమెంట్స్ అంతే. ఈ మూమెంటే వస్తుంది అన్నమాట సర్జరీ చేసేటప్పుడు అంత కూడా సూచరింగ్. ఓకే, సో నెక్స్ట్ దిస్ ఈజ్ స్కాల్పెల్ ఆర్ నైఫ్. ద మోస్ట్ ఇంపార్టెంట్ పార్ట్ ఆఫ్ ద సర్జన్ ఈజ్ కొంచెం గట్టి గ్రిప్ వస్తుంది అనమాట ఇలా చేస్తే. సో యాజ్ యూ కెన్ యూజ్ బోత్ ఆఫ్ దెమ్ యాజ్ యూ ఫీల్ కంఫర్టబుల్. జాగ్రత్త, ఇన్స్ట్రుమెంట్తో జాగ్రత్త, కట్ చేసుకోకండి, ఇంజూర్ చేసుకోకండి ప్లీజ్. So before giving any incision, you should have some imagine you give a proper neck. Okay? Proper neck ichi. అలా సైడ్ నుంచి కట్. Area infection free and pain free. There should not be pain to the patient. If there is pain, he will not allow to suture. మనకే అనుకోండి, మనం ఊరుకుంటామా సూచర్కి పెయిన్ కిల్లర్ అవ్వకపోతే? అవ్వదు కదా. ఇట్స్ నాట్ ద పెయిన్ కిల్లర్, ఇట్ ఈస్ ద లోకల్ అనస్థీషియా షుడ్ బి గివెన్. వాట్ షుడ్ బి గివెన్? లోకల్ అనస్థీషియా. దట్ ఈస్ lignocaine, xylocaine. Xylocaine infiltration should be given at the edges of the wound so that he will not have any pain during suturing. Now you take the syringe. Andra syringe తీసుకోండి. వెళ్తే లేదా ఈ స్పీడ్ తీసేవా? స్పీడ్ తీసి అక్కడ పెట్టు. ఇది కూడా తీసి, ఇది కూడా into the syringe. అందరు లోడ్ చేసుకున్నారా? ప్లీజ్ డోంట్ పోక్ యువర్ సెల్ఫ్. ఇంజూర్ చేసుకోకండి, జాగ్రత్త. ఓకే, అందరు చూడండి, లైఫ్లో ఎప్పుడు కూడా మర్చిపోకండి, యూ టేక్ ద ఎడ్జ్. గుర్తుంచుకోండి అందరు కూడా, యూ విత్డ్రా బ్యాక్ ఆల్వేస్. వన్స్ బ్లడ్ ఈజ్ దేర్, యూ స్టాప్ ఇట్, యూ పుల్ ఇట్ బ్యాక్. నువ్వు ఇలా పోక్ చేసిన తర్వాత, విత్డ్రా చేసిన తర్వాత బ్లడ్ వచ్చింది అనుకోండి, మీరు వెనక్కి తీసేయండి. లేకపోతే వాట్ హ్యాపెన్స్ ఈజ్, ఆఫ్టర్ గివింగ్ దట్ పోక్ యూ డైరెక్ట్లీ ఇంజెక్ట్ డ్రగ్ ఇన్ టు ద వెయిన్. బ్లడ్ వెనక్కి వచ్చిందంటే వెయిన్ ఆర్టరీలో ఉన్నట్టు, స్పెషల్లీ వెయిన్. బై ఇంజెక్టింగ్ డ్రగ్ ఇన్ టు ద వెయిన్ దేర్ విల్ బి రియాక్షన్, డ్రగ్ ఎలర్జీ, అనాఫిలాక్సిస్. Patient may die. Be careful. So before doing any procedure, after poking, after just you poke it and you withdraw. If there is no blood, just you inject it. Like that only. Withdraw, inject. 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 No patient is free of the pain. Okay? After giving this drug, patient will not have any pain. అర్థమైందా? Clean all the surroundings. You washed you debrided, you have done the debridement, thorough debridement is done, and you have given anesthesia also. Now the patient is ready for the suturing. Okay, na? Okay. Then, and this finger is here only. మనకు తెలియకుండా జరగాలి. Then only you will have proper grip. Okay, good. Okay, పెన్ పట్టుకున్నట్టే అందరం కూడా. Okay, now you insert it, pull it. ఈ టూ లేయర్స్ని ఒక సింగిల్ లేయర్ కింద చేసుకోండి. రాయిది వచ్చేస్తుంది. అగైన్ వస్తుంది అది. Again you hold it like this.
Sir, my hand up.
ఈక్వల్ లెంగ్త్లో ఉండాలి రెండు కూడా. అందరు చూడండి, ఫస్ట్ ఈక్వల్ లెంగ్త్లో ఉండాలి. ఓకే, దిస్ వన్ ఫ్రమ్ ద మిడిల్, దిస్ వన్ ఫ్రమ్ ద మిడిల్, ఈక్వల్ లెంగ్త్లో ఉండాలి. రూల్ ఆఫ్ 0.5 సెంటీమీటర్. Should be kept at the side. While removing it, you carry throughout the wound. Outside, so while removing it, it will not enter. If you keep it here, there is a path. No other. You make it one minute.
తీయలేదు ఇంకా. లేదు. బాయ్.
Okay, na? So next, let us go to next. Okay, but it is more vascular friendly. In mattress suture, there is vascular compromise will be there, but it holds good. Okay, technically also it is easy to perform. It is like simple knot only. You insert it. Come out. Like simple knot only. ఓకే, ఇప్పటి వరకు మనం సింపుల్ నాట్ చేసినట్టే చేసాం. దెన్ యూ హోల్డ్ ఇట్ ఇన్ ద మిడిల్, రివర్స్లో పెట్టాలి, నీడిల్ని రివర్స్లో పెట్టి అండ్ మీ హోల్డింగ్ మార్చుకోవాలన్నమాట. యూ హోల్డ్ లైక్ దిస్, సో ఇట్ ఈస్ ఈజీ టు పోక్. యూ టేక్ వన్ ఎడ్జ్, ఈ ఎడ్జ్లోనే తీసుకోవాలి. అనదర్ ఎడ్జ్. ఇక్కడ టెక్నిక్ ఏంటంటే ఎడ్జ్ ఆఫ్ ద స్కిన్ నుంచే తీసుకోవాలి. దెన్ ఇట్ విల్ కమ్ లైక్ దిస్. ఓకే, అండ్ యూ suture it here, not it here. Automatically so hopefully you all practiced it. Okay, this is the same knot with other hand. Okay, so one more technique is there. You can choose any one of them which is comfortable to you. మనకు చూపించినవన్నీ నేర్చుకోవాలని ఏం లేదు, one is enough. So one more technique is there. Okay, now you hold like this. ఇందాక దీంతో పట్టుకున్నాం కదా, ఇప్పుడు ఈ వేలతో పట్టుకున్నాం. ఓకే, చూడండి, like this, hook it, then pull it back. Like this, hook it and pull it back. So whichever comfortable. Okay, ఇంకోసారి చూపిస్తాను. Like this. Okay. Hook it.
Nampala Kirti. B. Prasanna. B. Kashyapi. M. Saishi. Y. Ananya. SGV Akshay Sai. B. Ishwari Priya. AK Krishna Chaudhary. Disha Pangal. Ankita. Nishat Fatima. Julia Oscar. Sai Kirti. Nishta Bajaj. Nishta Bajaj and S. Harshita. Nishta Bajaj. B. Santoshi. B. Sai Deepak. Shiva Chitti. B. Kaushik. B. Kumari Mrudala. G. Krishnavanshi. B. Vedapriya. L. Deepti Shri. VSS Vignatha Manashi. Charanya. Venkat Vijay Kumar Gupta. G. Venkat Sai Rakesh. K. Sri Meghana. This session and for teaching everybody with so much patience. And special thanks to Secretary Sir for conducting all the slots.
From the Department of General Surgery, we thank all the participants for patient listening. We have conducted 3 sessions successfully today, and tomorrow we'll have 3 more sessions. So hopefully tomorrow we'll start in time. Today all the sessions ran half an hour behind, late. So tomorrow hopefully we'll complete it in time. And we thank Ratna Madam, and we thank Janardhan Sir and all the faculty members,
all the PGs and our SRs, everybody supported well. That's why we could able to do it successfully. Hopefully tomorrow also we will do it successfully. Thank you everyone.
బైక్ అంటే ఇలా అయిపోయిందంట బైక్
Okay. So today's session from 9:30 to 11, 1.5 hours, right? Okay. So by 11 o'clock we are going to congregate. Okay. So knowingly, unknowingly, we are all half physician and half surgeons, right? MBBS, right? We are all half physician and half surgeon. Surgery is the integral. Every day, day in, day out, you will come across surgical cases. Injury, trauma is very common. Okay, not only the outside patients, our relatives, our own parents, any one of them may get injured, and we should be able to provide the minimum surgical treatment. Tomorrow you cannot ask someone for help for suturing of the wound, dressing of the wound. Provide basic surgical care to the patients, otherwise it is a medical emergency. Okay, so it is must. I think not only you people, those who are interested in surgery, I think you are all interested in surgery, that's why you came. Not only that, every student of MBBS student should know the basic surgical principles. Okay? Okay, so let us discuss. As most important and integral part of the surgery, suturing is important aspect of keep together. Why it is required? Why you should keep the edges of the wound together? Because for normal healing, the edges should be together. Opposition should be proper so that there will be normal healing of the wound. Wound heal out. If you don't suture it, may heal but it will take long time. But normal course of the wound healing, you should oppose the edges of the wound properly. For that purpose, you keep sutures. Okay? So what is suture made? Suture made is artificial fiber. Use it for suturing. What is suture material? There are artificial fibers used for suturing. Suture materials. So make an example question of what are the suture materials? Okay, next slide. Why you should know the suture techniques are why they are important? Suturing technique, why it is important? Why it is important? Because to support and strengthen the wound until it completely heals. For normal healing, as I already told you, we should oppose the edges of the wound together so that it will heal normally. To strengthen and support the wound until it completely heals. To reduce the dead space. What is dead space? Dead space is the space which is created after you give an incision. Okay, during surgery you give an incision. You separate the layers. After closing, you have to close anatomically layer by layer. There will be possibility of collection of the seroma, collection of the blood. So the dead space is dangerous for seroma formation, hematoma formation. You should not keep any space behind. That space is called dead space. There should not be any dead space while suturing after surgery. Okay? To prevent the dead space, you should know the proper suture techniques. To reduce the risk of bleeding and infection. Again, serum or hematoma is a source of infection. If there is a lot of serum left behind or a lot of blood is left behind in the dead space, it acts as a source of infection and there will be infection transformation. To prevent the dead space so that it will prevent infection and bleeding. For example, if you don't, especially on the scar laceration, if you don't close it properly, it will bleed. It will bleed until you close it, suture it will not stop. The peculiarity of the scalp is that you cannot stop by applying the pressure. Anyway in the body, venous bleed, you can stop by applying the pressure. Simple pressure is enough. But when it comes to scalp, it will not stop until you suture it. Suturing is the only treatment. Tomorrow you may practice the doing test rural area, some tribal area, as a medical officer, you are the only doctor there. You cannot refer them, no? You have to suture them. They come with injuries, they will be bleeding. You have to control the bleeding and you have to suture them. To approximate the skin edges to minimize the scarring. You all know that the wound healing, the end stage is scarring of the wound. To minimize the scar, you have to approximate the proper. With proper approximation, you will minimize the scarring of the wound. If you don't properly suture it, then there will be ugly scar, big scar. Okay? So to prevent it, you should properly suture it. So these are all the few causes of suturing. Why you should know proper technique. Name itself shows absorbable. They will get absorbed into the body after some period of time. Suture them, you keep the sutures there. After some period of time, they will get absorbed into the body. The absorbable sutures, sooner or later, they will absorb into the body. Depending upon the type of suture material you use, it will get absorbed. Time. For example, chromic acid, it will take 14 days, 10 to 14 days, 2 weeks time. Okay, white field, it will take 90 days. Okay, so depending upon the type of suture material used, it will get absorbed that particular period of time. Okay, so absorbable natural is catgut. Catgut is very commonly used everywhere. Catgut, you all know, that is a natural absorbable suture material. Okay. And a natural, what is that? Absorbable synthetic is Vicryl or polyglycolic acid. Polyglycolic acid. Non-absorbable, natural is silk. You all have silk with you. You please see the silk. For all skin injuries or skin suturing, we use silk. It is a natural, non-absorbable suture material. You have to remove them. Non-absorbable synthetic is proline. Proline is non-absorbable synthetic suture material. So this is ఉందా ఓపెన్ చేయనా కొత్తది I welcome Dr. Next, Vicryl, that is polyglycolic acid, that is absorbable synthetic, which you are seeing now. And the last one is proline. Polyproline is non-absorbable synthetic material. This on needle is not having that eye. Okay. It is the drug is directly inserted onto the needle. Okay. You please see everyone. అందరూ చూడండి. ఓకేనా? దీనికి ఇన్సర్ట్ చేసుకోవడానికి definition of suture materials, classification of suture materials, what are the types? Absorbable, non-absorbable, natural, synthetic. Very simple. Okay. What are all the suture materials we generally use? Silk, Vicryl, proline. Silk and proline are non-absorbable. Vicryl is absorbable. Catgut also generally used. Okay. So let us start the practical aspect of this minor case, simple procedure. Surgical principles are same to the any procedure. Okay? We have to learn the basic surgical principles and we have to follow them during any procedure. It may be minor procedure, major procedure, simple suturing, whatever. Any procedure is, all the basic surgical principles are followed. Okay? So before suturing, you have to keep your hands clean. Okay? మనం మన చేతుల్ని క్లీన్గా ఉంచుకోవాలి. Okay, for that purpose, you have to wear sterile gloves. Before sterile gloves, you have to wash your hands. So that is altogether different topic. As time is restricted, we cannot discuss all the details. You have to keep your hands clean and you have to wear sterile gloves, surgical gloves, not these examination gloves. Just for learning purpose, we have kept a pair of these examination gloves, thinking that they are all sterile. You wear them under gloves, because every procedure is done with wearing the gloves. So you should be adapting yourself, doing any procedure after wearing the proper gloves, sterile gloves. So what is the use of wearing these gloves? These gloves will prevent the infection. Okay? They are disposable gloves. You use these gloves for one patient and you dispose them. You use another set of new gloves for another patient. By doing that, you are not carrying infection from one patient to other patient. And you are protected from patient's infection carrying to you. So you are protecting yourself. So that is the use of gloves. Gloves will protect you as well as the patient. So glove is, if you go to history back, invention of glove is one of the important aspect of the progression, evolution of surgery. Glove is very, very important. Okay. So gloves, you should sterile gloves before doing any procedure. Okay, next. Before doing any procedure, you have to keep your hands clean, you have to wear gloves, and you have to keep the wound and surroundings of the wound clean. Okay? So there is wound, classification of wounds, what to do with the wound, that is altogether different topic. We have to follow the basic surgical rules while doing our suturing. Okay? So you have to clean it. So there is an instrument called sponge holder. Sponge holder is used to hold the gauze piece. So, okay, you take the artery forceps. Actually, we should not use it, but use them for now. Okay? You take the gauze piece, you hold with the arteries, and I will show you how to hold the arteries. First is నేర్చుకోండి. Any instrument holding, there is a standard way of holding the instrument. You use your ring finger, you keep it in one hole, and use your thumb and the other hole. అందరూ కూడా ఇష్టం వచ్చిన ఫింగర్స్ పెడతారు, అలా పెట్టకూడదు. You put your thumb finger, subconsciously also you have to hold like this only. ఇప్పుడు నాకు తెలియదు, నేను పెట్టాను నన్ను, but my fingers are like that only. This is the way of holding. You keep your thumb in one finger, ring finger in another hole. Thumb in one hole, ring finger in another. అందరూ అలా పట్టుకోండి. పూర్తిగా ఇన్సర్ట్ చేసేకండి, ఇక్కడ వరకు కూడా ఇన్సర్ట్ చేయకండి. ఈ ఫస్ట్ సెకండ్ ఫాలెంక్స్ మధ్యలో పెట్టుకుంటాం జనరల్. And your index finger will support the instrument like this. Then you will have proper grip of the instrument. The movements of surgery are these pronation and supination movements. Okay, like this. You have to practice this movement only. Cricket ఆడినోళ్ళు flick ఆడినట్టు అనమాట. Like this. Flicking movement. Pronation and supination. Wrist. Okay? చెయ్యంతా కదలకూడదు. Just like this. Okay? And opening and closing of instruments. Then what I observed yesterday is most of you don't know how to open it. Zoom it. ఈ మూమెంట్ చూడండి, దిస్ ఈజ్ క్లోజింగ్. నో, క్లోజింగ్ ఈజ్ వెరీ ఈజీ, జస్ట్ క్లోజింగ్. ఇక్కడ చూడండి, ప్రెషర్ పెట్టి కొంచెం బయటికి తోయాలి, అవుట్ సైడ్ ప్రెస్ చేయాలి టు ఓపెన్ ఇట్. ఫస్ట్ ఇది ప్రాక్టీస్ చేయండి. ఓపెన్ ఇట్, షుడ్ బి ఏబుల్ టు ఓపెన్ ఇట్, ఫింగర్స్, ఇగో ఈ ఫింగర్ ఇక్కడ పెట్టుకోండి, సపోర్ట్ ఇట్, ఓపెన్ ఇట్. అందరూ ఓపెన్ అవుతుందా, ఎవరు ఓపెన్ అవ్వట్లేదా చెప్పండి. ఏం మొహమాట పడకండి, నథింగ్ రాంగ్ ఇన్ నాట్ నోయింగ్. ఓకే, వీ విల్ లెర్న్. ఓకే, తప్పేం కాదు. రాకపోతే మాకు రాలేదు, మా ఫ్యాకల్టీ ఉన్నారు, మా పీజీస్ ఉన్నారు, దే విల్ హెల్ప్ యూ. ఓకే, ఓకే, ఓపెనింగ్ క్లోజింగ్ అయిందా? ఓకే, నెక్స్ట్. సో గాజ్ పీస్ పట్టుకోండి. ఇట్ షుడ్ బి ఇమాజినరీ, ఇట్ షుడ్ బి స్పంజ్ హోల్డర్. స్పంజ్ హోల్డర్ is specially designed to hold the sponge holder. పేరే ఉంది దాని, స్పంజ్ హోల్డర్. ఓకే, నేమ్ ఇట్ సెల్ఫ్. సో ఇక్కడ లేదు కాబట్టి వీఆర్ యూజింగ్ ద ఆర్టరీ ఫోర్సెప్స్ విచ్ వీ షుడ్ నాట్ డూ, లూజ్ అయిపోతాయి అనమాట. ఓకే, యూ టేక్ ఇట్ లైక్ దిస్, యూ డిప్ ఇన్ సమ్ aseptic solutions. So surgery should be always done in aseptic conditions. Surgery should be done in aseptic conditions, infection free conditions. Two things we have to remember, that always any procedure should be done in infection free. I welcome the faculty member Alakshmi Madam garu and other postgraduates to the session. So aseptic conditions lone మనం ఎనీ ప్రొసీజర్ చేయాలి. ఓకే, ఓన్లీ ప్యూర్ aseptic means infection free conditions. We all know that the biggest enemy of a surgeon is infection. ఎందుకు ఇవన్నీ చేయాలి? Why you should all these things you should do? To prevent the infection, isn't it? Infection may be simple, minor infection, it may be, he may land up in sepsis also. As we all know that the infection that you acquired in hospitals are nosocomial infection. They are very difficult to treat. So better avoid the infection. shoulders. So let us complete this session by certificate distribution. అయిపోయింది
రండి సార్ రండి
M. Leeladhar. M. Leeladhar. T. Usha Bhavani.
సార్ రిజిస్టర్ రిజిస్టర్
T. Usha Bhavani. C. H. Viharika. B. Jayashree. B. Jayashree. Aslesha. V. Dhanuj. Neelashri. B. Abhishek. Suvarshini. Suvarshini. P. Chandana. R. Sai Shruti. M. Ratnameghana. M. Ratnameghana. M. Navyashri. Sai Yashwant. P. Sai Yashwant.
యశ్వంత్ అంటే మా ఫస్ట్ ఇయర్
K. Swaroop.
యశ్వంత్ బ్యాచ్
K. Divya Vaishnavi. K. Satvik. P. Akash. Patrika. Patrika.
జగదీష్ సార్ జగదీష్ సార్
J. Jahnavi. Shivatmika. M. Pujita. M. Pujita. Sri Sahiti. S. Likita. M. Amrita. M. Amrita. Shiny Sharon.
ఇవ్వండి సార్ ఇవ్వండి రండి సార్
J. Hemant. J. Hemant. J. Suprita. J. Suprita.
సుప్రీత మేడం
K. Srimeghana.
రండి 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 రావాలి
K. Srimeghana.
So what is suture? Suture is stitch or series of stitches made to secure opposition of the edge of the wound. So you should suture a wound to approximate the edges for proper healing. Okay? There is a wound, there are edges, those edges should be approximated properly, right? There are so many complications which will follow on. So you have to suture them. What is the material used for suturing? It is artificial fibers which are used to it completely heals. So by keeping the sutures, you are supporting the wound for proper healing. Okay? And there should not be, to reduce the dead space. What is dead space? After giving the incision, you have to close it layer by layer without leaving behind any space. That leaving the space is for dead space. If you leave behind any dead space, every possibility that there may be collection of seroma, there may be collection of blood, hematoma, which will delay again the wound healing. As well as it may act as a source of infection, and there may be pus collection, right? The wound will get infected. If there is bleeding, for example, if you take scalp injury, right? Scalp injury, suturing is the only treatment. If you apply pressure, there will not be any stoppage. The bleeding will not stop. You have to keep sutures. So to reduce the risk in certain places, you have to keep the sutures to stop the bleeding. Okay, scalp especially. Okay, and to approximate the skin edges to minimize the scarring. Scarring is the final stage of healing, right? If you keep proper suturing, if you properly approximate the edges, there will be a good scar. If you leave it or if you improperly suture it, there may be ugly scar, bad scar, okay, big scar. Okay, chin injury, small injury with big scar. It is important to everyone, all doctors, to learn the basic surgical principles and surgical techniques. Okay, as a doctor, any doctor, physician, surgeon, anybody. It's not like I can treat malaria also. Tomorrow you have to suture the wound also. So no other go. Some of our relatives may get injury. Then you cannot ask a surgeon's help. No. Intlo you have to suture it. This is the most common suturing material we use in day-to-day life of our practice. To suture the skin we use silk. Okay? Silk. Andro chudandi. And non-absorbable synthetic material is poly. Ruling ఇందాక ఓపెన్ చేసామమ్మా.
బ్లూ కలర్ లో ఉంటుంది చూడండి.
Ruling. Okay, so that is one type of suture material which is non-absorbable. Okay, so let us continue. So there are this suture material. Vicryl is directly attached to the needle. You all take the needle which is in front of you and see that there is a hole, there is a key, there is a eye in this needle. To insert this minimum trauma. Anastomosis చేసేటప్పుడు బౌల్ మీద సూచర్ చేయడానికి వాడే నీడిల్. దట్ ఈస్ రౌండ్ బాడీ నీడిల్. Or acromasity, what is the use of suturing materials? What are the types of suture materials? Suturing, why should be done? Types of suturing. Okay, there are two types of suturing generally we do. One is simple suture with simple knot and another.
Okay, welcome. I think you are from different places. You know, in this, why we should learn sutures issue. But the drawback is, it will give an ugly scar and it will take more time. So the advantage of suturing is to cut short the time of healing and also a thin surface scar. Nowadays, even different types of and subcuticular sutures where the dermis subdermally we won't see any sutures. There won't be any suture marks. So that it is more cosmetic. That is subdermal suture very much generated. What the needle you should choose, what the suture material you should choose, what is the technique you use. Simple sutures, or subcuticular sutures, or macro sutures, or secondary sutures. Sometimes in burst abdomen, we may need to suture tension sutures also. Sometimes tension sutures. There are various types of sutures. In this, cutting needles, reverse cutting needles, tapered, and in this cutting needles there will be some ridge at the end, so that it will give some trauma. But it is needed.
Through the history, it is one of the important steps in the development of total evolution of surgery. Gloves are very, very important. First, keep your hands very clean. wear proper surgical gloves. Next, the surroundings which the wound is there, you have to keep it clean, infection free conditions and pain free conditions you have to do the procedure. The biggest problem and biggest fear of the patient is that surgery is very painful. So you have to do something to stop that pain and you do your procedure. You assure the patient that it is not painful. I will give some anesthetic agent or some drug so that you will not feel the pain. Assure them, and then only you can do the procedure. Otherwise, he will be jumping on the table. He will not allow you to do the procedure. Okay? Betadine solution. Okay? Betadine solution could be used. Hydrogen peroxide is used. For example, if the wound is infected, then you can use hydrogen peroxide and wash it with normal saline. The spirit is not directly poured on the wound surface. Spirit is used to clean the surroundings of the wound only. You should not keep the spirit directly on the raw surface of the wound. Okay? All others, normal saline is used, hydrogen peroxide is used, okay, betadine is used, but not the spirit. It is very painful. Okay? So now you take the antiseptic as well as the clothes, drapes, everything should be sterile. Now you keep a whole towel here. Okay? Standard books are there which we have to follow. So there are two methods of holding of the instrument is, one is pen like holding. You hold it with one of the method which I have told. Okay? I given incision, just a piece of cut chest these and
Make the opening big.
అలా చేయండి చేయండి అందరు చేయండి పీస్ మధ్యలోంచి తీసేయండి సో దట్ ఇట్ విల్ బికమ్ వైడర్ లైక్ ఏ వూండ్. జాగ్రత్త అమ్మా, ప్లీజ్ డోంట్ ఇంజూర్ యువర్ సెల్ఫ్. చేయమ్మా, ఇన్సిషన్ ఇవ్వండి. గివ్ ఎ నిక్ creation of the anesthetic agent. Xylocaine is available. Lignocaine is available everywhere. You take lignocaine, for example, this is the lignocaine. Is similar to simple knot. You insert it, you come out. తర్వాత ఈ ఎడ్జ్ నుంచి ఒక బైట్ తీసుకుంటాం, నెక్స్ట్ ఆ ఎడ్జ్ నుంచి కూడా బైట్ తీసుకుంటాం. అక్కడ బయటకు వచ్చిన తర్వాత యూ విల్ నాట్ టై అండ్ నాట్. Haripriya.
I am Jahnavi. Please make it fast. K. Hemasharanya.
Jahnavi.
Hope everyone learn something. You need to practice every day.
Haripriya Vasala. P. Likita.
Hemasharanya.
Haripriya.
P. Likita.
Nikita.
A. Dilip Kumar.
Nikita. గట్టిగా.
Last favorite student.
A. Dilip Kumar.
Dilip Kumar.
P. Madhurima. Pravalika.
Madhu.
Pravalika.
Pravalika. Gayatri, Sheikh Rubia,
Gayatri,
Himani,
Sheikh Rubia,
Himani,
Imani.
J Chandana,
Chandana.
J Chandana,
Chandana.
Jairam, S Deepika, B Shweta,
Deepika,
B Shweta, A Mrudula, Manas, Neha Amrita,
Manas. M student. Applause. Because he came from long distance.
Vali Yashashwini,
come fast. Next.
S Pratyusha, S Pratyusha, K Lakshmi Priya, K Tejashwi,
Lakshmi Priya,
K Tejashwi, C Prashanti, Yashashwi Patti, K Bindu Sahiti,
Dashanti,
K Bindu Sahiti, P Shravani, Nakshatra, Nakshatra,
Nakshatra, star.
J Neha, J Neha,
Neha.
M Karthik,
Karthik.
Tanya Jain, Ganesh Srivamsi,
Tanya. M student. Again. Single student.
Sai Charan, Y Sai Charan, Mitra Fani Sai Reddy,
Sacharan. RM sister. నేర్చుకున్నాం.
Mitra Fani Sai Reddy,
Sai Reddy.
R Sai Kumar, T Geetika Bhavani,
గుడ్ బాగా చేశారు.
భవాని. గీతికా భవాని. భవాని మన స్టూడెంట్. Hope everyone learned something. You are all most welcome to further follow up in our department. All our faculty members are at your disposal. Anybody interested in surgery, you please come and you please ask your questions. We are there to clarify. Any doubts? Okay? Okay, thank you. Everything. Now our standards are going down because we are not showing interest in practical aspects. Learning skill is very important for survival outside. So we are showing more interest on post-graduation, super specialty. Good. They are all good. We should not carry infection to the patient. If you go back to the history, that is the main difference. They used to do surgeries, but patient used to die with sepsis, unknown cause. Why? Because aseptic and antiseptic measures were not taken properly. Patient used to get the infection and they used to die with sepsis. So the biggest invention, one of the important invention in the evolution of surgery is, one is anesthesia. That means you are making pain-free condition to operate the patient. And two is gloves and aseptics and antisepsis. Asepsis and antiseptics. Gloves plays a major role for surgeon. Why? How gloves are important? How protect you from the infection, as well as once you have completed your procedure, you have to take off the gloves and throw away, dispose them. That prevents the carry of infection from one patient to other patient. Especially in wards, we should use only single-use gloves. Okay, you cannot it's very important not to carry infection from. This is the common mode of infection in the wards. One patient gets some wound infection. Tomorrow, you see the other patient will also get the same type of infection. Day after tomorrow, some other patient. That means somebody carrying the infection from one patient to other patient. Very simple. Knowingly, unknowingly, our house surgeons use one pad to one patient and use the department, all our professors, you observe that all our professors came, associate professors, faculty, senior residents, everybody came and helped, participated actively in this program. So we always open for your doubts. Our department always welcomes not only our students, any students who attended this program, you are all most welcome for further learning. Okay? So thanks everyone, thanks a lot. Bye.
D. Laharika. Aishwarya. Durga Roshan.
Come fast first.
Mahati. Sujana. Devi.
Intlo home department.
Devi. Likita.
Board Likita, the writers.
Okay. Sridivya. Bhavana. Apurva. Sai. Teja Mahavir Ratnala. Harika Devi. Rohit. Dhwani. Uday Sharmila. Shravya R. Shravya. B. Vamsi. Uday. Shivam Shukla. Rishita. G. Nikita. G. Rishita. Bharat. Amrita. Sarvani.
क्लासमेट के मैडम
Which one? రండి
నీరజ్ సత్యప్రియ కే సూర్యప్రకాష్ శిరీష లావణ్య కృష్ణప్రియ భానుప్రవిక జశ్వంత్ శరత్ షాగి
కుమార్ నువ్వేనా ఓకే గుర్తుపెట్టాను